I'm Charlie Milburn for HITExchange Media. We're talking to Dr. Paul Frisch, Chief Technical Officer for RFID and Healthcare Consortium, a nonprofit, vendor-neutral organization dedicated to educating healthcare professionals about radio frequency identification technology uses in healthcare. RFID brought its hospital patient smart room to the HIMSS 11 conference to showcase some of the best use of healthcare technology for patient monitoring, medication administration, updating electronic health records, keeping patients safe, and tracking hospital equipment status. Thanks for joining us, Dr. Frisch. Tell us, what was the impetus behind the creation of the Hospital Patient Smart Room RFID Showcase?
Yeah, the main purpose of creating the showcase was really based on trying to convey and extend the knowledge of the application of RFID, potential applications of RFID as they integrate into the healthcare space. Most of the hospitals deal with a variety of technologies, and RFID really provides a connectivity piece that enables identification and association to tie many of those applications together.
How did you decide what to include in this highly integrated environment?
Well, the brainstorming process was really based on looking at the technologies that most hospitals currently have and looking the directions that they want to move in. And most hospitals are moving into some very clear directions, focusing on device interconnectivity, being able to take physiological patient-related data, put it directly into the electronic medical record. And that starts to develop into a variety of different type of issues. Some of them have to do with identification and association. So how do you accurately identify which patient's data is correlated to which device and where does it go in the medical record? And how you do that is, fundamentally either a barcode or an RFID type of technology. The other piece really has to do with the visualization of what's happening on the hospital floor. So there's a lot of complex processes going on. The ability to track where you are, where your staff is, what they're doing, what they're interacting with, where the patients are. It adds an entire different dimension to the operability of the hospital floor, increases the potential for patient care and safety.
For hospitals, what are some of the obstacles to replicating the RFID Hospital Patient Smart Room environment? Do you think it's something hospitals could readily accomplish today?
I think the vendors are always worried about competition and working against each other, but I think the vendors are starting more and more to realize that there's a lack of ability to provide a total solution in this particular area, and they are somewhat dependent on collaborating with each other to generate a hospital-based solution. So in a hospital environment, I think there is some politics involved to work with your vendors and ensure that your vendors actually move to the right direction, but most of the vendors can no longer provide a complete solution to solve the hospital's issues dealing around connectivity and identification. So it's almost required that they collaborate at some specific level. So I think in a hospital you could actually develop this type of platform quite easily.
How does the patient smart room differ from what you might actually see in a patient hospital room?
And there's some, RF wireless things that you need to consider. In a real environment, you wouldn't be running as complex of a scenario as you are here. You would choose one or two specific vendors that your hospital does business with and be able to work out the detail. Here we're running 4 or 5 competitive products at one time, all trying to use the same RF space. So it's a little bit more of an intense environment than you would normally have.
Now, what do you see as the projected timeline for a typical hospital who wants to install this type of smart clinical technology?
Well, it's hard to say. The timeline is based on a lot of things. It would take quite a bit of effort to evolve this, and it's very hard to predict the timeline. You wouldn't implement a total solution like this all in one shot. You would attack it probably in a piecemeal type of approach, depending on what your priorities and your application are. You would roll out one piece of it, maybe connectivity, and you would then pilot that and make sure that works and then deploy that out. Then add the localization and identification pieces or whatever your next priority would be. So it could take quite a few years to roll out something that would look as intense as the smart room does.
Great.
And I'm not sure you would roll it out hospital-wide. You would do certain things in certain areas, like in the ICU, emergency room, you would do maybe a more intense area. The other areas would, timeline is hard to predict.
Now, in a real-world application, does this type of process control make sense, and how does it impact standard of care?
Interestingly enough, in a healthcare environment, the processes are pretty well established. So there's a lot of checks and balances built in. So really what you're doing is applying technology to the processes that exist. Yeah, in some cases, obviously, the processes are changed, augmented, hopefully improved, but nevertheless, the standard of care or desired standard of care is pretty well established in most hospitals. So you're really kind of just trying to augment that by adding the technologies to it.
What do you see on the horizon for RFID technologies that wasn't demonstrated in the smart room?
RFID solutions are so broad-based. You can expand out to document tracking, you can expand out to exit security type of applications. There are hundreds and thousands of applications that are all based on hospital priorities, so it's hard to say. Some of them were not worth demonstrating here because hospitals are still in their infancy in deploying RFID anyway, so we wanted to be able to hit the ones that really were probably the most obvious and the ones that had the biggest bang for the buck.
Dr. Frisch, one last question. Where do you suggest hospitals start with RFID technology?
In a broad sense, RFID falls into two categories. One is localized identification, location and identification. It has to do with certain processes like maybe cleaning or identification at bedside type of applications. And then there's a global type of solution that says I can track you and monitor you everywhere in the hospital, know where you are. So it's really a mix of those two anyway. So I think that where you start there doesn't matter. Actually, it's just a question of which one is of more value to you institutionally.
Thanks for watching this HITExchange Media special report, and a very special thanks to our guest, RFID CTO Paul Frisch. To visit the virtual RFID hospital patient smart room, watch the companion video on HITExchangemedia.com or visit the Consortium website at rfidinhealthcare.org.